Hi, my name is Camille King. I'm a senior athletic training student at Florida Gulf Coast University, and today I will be kind of walking you guys through a SCAT5 assessment and performing one on my model athlete. Just a little background information to kind of set the scene in a way. In any concussion situation, you first will follow the basic principles of first aid. So make sure they have circulation, airway, they're breathing, they have a pulse, everything like that. So we'll say that everything is normal for this athlete. Additionally, you would look for any red flags that happen immediately following the trauma. So if there's any severe neck pain or lack of movement in the neck, double vision, seizure, loss of consciousness, profuse vomiting, severe weakness or tingling. If there are any of these signs, you would just immediately refer them before fully conducting a SCAT5. So we'll go ahead and say there are none of those red flags, and I'm able to start my SCAT5 assessment. Now I'm here with my athlete. We'll just say for the sake of this video that I am covering her soccer game. I saw her go up for a header, kind of fall to the ground, stay a little bit longer than normal, but was able to get up and continue playing. A few minutes later, she came off of the field complaining of a headache and a little bit of dizziness. So now I'm going to start my evaluation with her. So obviously I observed the injury, so that section on the SCAT5 I can go ahead and fill out. The next part would just be asking basic Maddox questions for a overall memory assessment. So as soon as she comes over to me and I kind of get the rundown of what's happening, I'm just going to ask her a few things to see where she's at orientation-wise. So do you know what venue we're at today?
Yep, we're at Florida Gulf Coast University.
Okay, and who are we playing?
We are playing another team.
All right. Do you know who scored last?
They did.
They did? How did they score?
They kicked it in the goal.
Okay, was it your fault?
No.
No. Okay. Yeah. So as you can see, she answered all of the memory questions fine. So I can now continue into the SCAT5. If she were to show severe impairments, had no idea where she was or anything like that, I could, that would be a sign of a red flag, and I would refer her immediately. Next would be the Glasgow Coma Scale. This would be more for unconscious patients, but as you can see, since she was able to get up and continue playing and then walk off to the side of the field and tell me what happened, her eyes are moving spontaneously, she is oriented in her verbal responses, and obeys commands for all of her motor responses. She's also reporting pain-free in any cervical neck motion or movement, active, passive, anything. So cervical spine assessment checks out. So now I can continue on with the SCAT5. After completing the on-field assessment, we can now move to the off-field assessment, which could be done in the clinic or sometimes the sideline, but mostly the AT room. So I have my patient in here. We would go ahead and fill out the athlete background information just to kind of get the facts straight. What school, the date of the injury, age, gender, past history of concussions or anything related, any medications that she may be on, just to make sure we know everything we need to know before we dive deeper. The next thing I would do is print out a symptom evaluation form and go ahead and give it to her, and she's going to rate her symptoms on a scale from 0 to 6, 6 being absolute severe, need to go to the emergency room, 0 being don't feel it at all. I could then review her symptoms, see the strength of them, and then go from there. So after the symptom evaluation, we would start a cognitive screening. The first part of the cognitive screening is the orientation aspect of it, which I kind of already did with the Maddox memory questions. Basically, it's just asking, do you know where you are? Do you know what day it is, what time it is, etc. So I'm not going to do that for this patient because I've already kind of touched that base earlier in the on-field assessment. The second thing we're going to do is test her immediate memory. So what I'm going to be doing is I'm going to be telling you 5 words. Wait until I finish saying all 5. You're going to say them back to me, and then we're going to repeat it 3 times. Okay? So the words are candle, monkey, sunset, lemon, movie.
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 Good. We're going to do it one more time. Candle, monkey, sunset, lemon, movie.
Candle, monkey, sunset, lemon, movie.
Good. So she had no errors, so her memory seems to be good. Another way to evaluate it is we're going to do some digits backwards. So basically what I'm going to be saying to you is I'm going to give you a number of digits. I'll say them to you in the correct order, and then when you say them back to me, you say them in the reverse order. So if I say 1, 2, 3, you would say
3, 2, 1.
Good. All right, so the first digits, 4, 9, 3.
3, 9, 4.
6, 2, 9.
9, 9, 2, 6.
All right, now I'm going to add another digit. 3, 2, 7, 9.
9, 7, 2, 3.
9, 8, 2, 4.
4, 2, 8, 9.
7, 5, 3, 8.
8, 3, 7, 5.
And then the last one, I added another digit. 6, 2, 9, 7, 1.
1, 7, 9, 2, 6.
Good. So she had 1 error, which is very good. There's not really a right or wrong number of errors that a person can get. You kind of just take it all into perspective. So the, factors from their symptom eval sheet, from their Maddox memory questions, from their word memory, their number memory, all of those things you kind of take into consideration to see, oh, well, they only had a few errors here, so they seem to be fine. So it's all up to the discretion of the AT. The last thing we're going to do for cognitive assessment is you're just going to say the months to me in reverse order. So you're going to start with December.
December, November, October, September, August, July, June, May, April, March, February, January.
Good job.
That was hard.
So that concludes our cognitive assessment. Okay, now I'm here with my patient and we're moving on to the neurological screening. The first thing I'm going to have them do is I'm going to have you read out loud. So do you see that sign over there?
Yep.
Can you go ahead and read on it for me?
Brachial plexus.
Good.
Mechanism of injury, shoulder depression.
Okay, good.
In one direction.
Good. The next thing I'm assessing is just to confirm that she still remains pain-free with any cervical movement. So I'm going to go ahead and have you look up, down, side to side. Pain with that?
Nope.
All right, can you go ahead and do a whole rotation? Everything's good?
Yep.
All right, cool. The next thing I'm going to have her do is just make sure she has normal eye movement. I have popsicle sticks in my kit, but left my kit out by the field, so we are going to be using my finger. So focus on my finger. You're just going to follow it. I'm about a foot away from her face. I'm going to do 3 passes of each movement, and I will be observing for any bouncing at the end of the range, any nystagmus going on, anything abnormal, differences in dilations, different in reactions, but everything seemed normal for her. If there were any of the things that I just listed, they would be indicated as signs and symptoms of a concussion. The next thing I'm going to have her do is just a simple finger to nose, testing her coordination a little bit. So I'm going to have you stand with your arms to your side, and you're going to bring one fingertip to your nose at a time. You're going to do 5 times each. Alright, so she is able to perform that flawless. Okay, so the first thing I'm going to have you do is get into tandem gait. Do you know what tandem gait is?
Is that where I'm like in a straight line?
Yes, so one foot in front of the other, but you're going to put your non-dominant foot in the back.
Okay.
So you'll have, you said right foot, so just, you're going to stand on that line.
Okay.
Good. Now we're going to progress into some balance things. So what I'm going to have you do is you're going to remain in that stance, put your hands on your hips, you're going to close your eyes and stay there for 20 seconds. I'm going to count how many errors you have. A error would be if she were to open her eyes, lift her hands off her hips, fall out of it, sway too much, anything like that, anything showing difficulty. Alright, you're good. That was 20 seconds. The next one that we're going to do is called single leg stance. So you're going to stand on your dominant foot, hands on hips, and try and keep that leg as close to your midline as possible. Don't go abducted or anything, okay? And go.
Just cramp in my foot.
And like the memory aspects, there are some times where one who is concussed will have less errors than someone who's not concussed. It's just all about the baseline. So it's knowing your athlete, knowing what they struggle with. If they struggle with memory or struggle with balance, it may not necessarily be the concussion that is causing this. And then one last balance thing is just going to stay on 2 feet, 20 seconds, and eyes closed. Okay, good job. All right, now that we've completed the on the field, off the field, cognitive, memory, and neurological assessment, we are nearing the end of the SCAT5. So remember those 5 words that I asked you a little while ago? The last part of the SCAT5 assessment is the delayed recall. So after we've gone through all of those examinations, I'm now asking the patient to tell me any of those 5 words that you remember.
All right, we got candle, sunset, lemon, monkey, jacket. Is jacket yours? Jacket mine. Jacket's yours. That's all I got.
Okay. Again, 4 out of 5 is very good, especially when they didn't know they were going to have to remember those. But basically I take up the scores and the comments and my observations from all different parts of the SCAT5, and then step 6 would be decision. So based on her symptoms, I would monitor her the rest of the night, see if her symptoms kind of go away or get worse. If any of the symptoms get worse, I immediately refer. If anything gets crazy, if you start throwing up, severe headache or any neck pain, dizziness, tell your mom and dad, go to the hospital. And then she had a very good SCAT5, so I would probably just evaluate her again tomorrow based on the symptoms, keep an eye on her, inform her parents, give them information about overnight, and then if they do choose to go to the doctor about it, a physician will then evaluate her for a concussion, and she will report back to me saying if she is diagnosed with a concussion or not. We take the recommended rest time, and then we would start a return to play, which is about a 5-day return to play, easing her back into physical activity so that not to provoke a second impact syndrome or anything like that. So, my name is Camille King. This was my patient, and that is a SCAT5.